RUMAP is focused on dealing with two critical issues in rheumatology, but really across internal medicine. First, access is a major problem in rheumatology. 6 to 9 month waits are common in Boston, and across the country it goes up to a full year. We're not training enough rheumatologists. We can't really train our way out of this supply-demand mismatch. On the opposite side of the slide is the cost of common drugs for rheumatology practice. So at the same time that we're developing great drugs that are giving patients real hope, these drugs are astronomically expensive, and payers really have a difficult time shouldering the burden of these costs. RUMAP is something we've been developing for the last 6 years at Brigham and Women's Hospital in rheumatology. We've conducted 3 clinical studies over this time. We've enrolled over 300 patients that have filled in over 30,000 patient-reported outcomes. We've had multiple user-centered design focus groups with patients and clinicians, and we have great adherence with RUMAP. Patients fill in 60 to 70% of the PROs that they're fed. We've conducted these studies, published our findings, and have had great response within the rheumatology community. The problems that we're trying to solve first are the payer is currently shouldering the burden of these astronomically high costs. They have few data to understand the spend and few data to understand whether the drugs are actually improving patient outcomes as suggested. Providers have really no insight into the patient's symptom trajectory between visits, and practices really don't have an incentive to monitor these things between visits currently. RUMAP helps to solve some of these issues. Payers receive real-time data insights related to the medication use and the patient outcomes. Providers can view the symptoms and have behavioral nudges fed to them through the electronic health record. And practices can actually bill for the remote therapeutic monitoring. They can participate in value-based care and can dynamically reschedule the patients who are stable. This is what RUMAP looks like. It's deceptively simple. The patients receive messages on their phones or tablets every other day to fill in PROs. The PROs are validated short forms of promise measures. These are NIH-developed measures. Immediately after entering the data, which takes less than 30 seconds, they're given a green, yellow, orange, red slider, which we've developed through the focus groups with them. They immediately understand how they're doing compared to other patients. They're able to see their history over the last 3 to 6 months. As well, they get answers to their frequently asked questions through a Learn tab. And then they're able to program medication reminders for their rheumatic disease drugs when they're taking their drugs and when they're not taking their drugs, and giving reasons that providers can act on as well as payers can understand. The provider-facing side of this is integrated within the EHR. This is Epic. We've figured out how to integrate within Epic. If you can integrate within Epic, you can integrate in any EHR. And clinicians see the data immediately, again, using the same graphic of the red, orange, yellow, green. Focus groups with clinicians say they understand these data, they know how to use them. When I'm in the visit room with a patient, I turn my screen to the patient and let them know that I'm using this data to make evidence-based therapeutic decisions. Patients are highly satisfied and engaged with the process. But the real secret sauce are the behavioral nudges, which are delivered through in-basket messages within the EHR, and the most important being the patient who's stable, who can have a delayed visit, opening up space on a clinician's schedule for the patient on the wait list or the patient who's flaring and needs immediate attention. The first commercial partnership is in development. We have, again, the providers can bill for the remote therapeutic monitoring. They can dynamically reschedule patients who are stable, or even see the patients who are unstable earlier. They're also able to participate in value-based care. The CMS program, as well as many insurers, have similar programs that these PROs can fulfill. We've had a very positive initial market response in rheumatology practices. 6 out of 6 large rheumatology practices are very interested in further discussing RUMAP. None have current RTM solutions or dynamic rescheduling opportunities. They're all interested in easier collection of PROs for value-based care. We think this is a large and growing opportunity. We value this using 74 million patients with serious chronic disease. This is obviously beyond rheumatology. We see this PRO app being very applicable to patients of all stripes with different chronic illnesses. This is a growing market. We estimate about $500 of value for the payer or provider, and 15% of this would accrue to the new company. The available market is approximately $770 million if we focus on the 14% of beneficiaries covered by ACOs or Medicare Advantage plans. We have done a competitor screen, and there are people who are using PRO apps and selling these in the market. However, none really are able to provide all the things that RheumApp provides. Importantly, dynamic rescheduling and the integration within the EHR are uncommon. So we've secured over $1 million in R&D grants from pharma and foundations over the last 6 years, and recently were awarded a $200,000 Brigham Ignite Award to externalize RheumApp, perform regulatory review, allowing for RTM, and prepare for a commercial pilot. We founded a new company and hired a CEO who's here with me today. We're planning on expanding commercial pilots with 2 to 3 more rheumatology practices, develop the gastroenterology and neurology extension products, pursue channel relationships with companies like McKesson, Cardinal, and a large rheumatology MSO, and testing the water with payers. We will continue also with software development, adding an AI chatbot. So thanks very much for your attention. I'll be out in the hallway. Love to chat with you.